My patients often ask me, how did I come from being the most rural physician in Maine on an island for 10 years to being in Back Bay, Boston in a concierge medical practice? My experience is that I absolutely loved caring for the community in Maine. It was 1,200 fishermen families and summer people, and I was the solo physician for 10 years, where I ran the ambulance, did advanced pre-hospital care for heart attacks. I did short-term counseling. I did home visits on the elderly, home hospice, took care of little children, and dealt with a lot of complexity in a remote setting. And I had medical students come and train with me on that island setting. So I brought that experience to Boston, came to Boston to do a master's in public health at Harvard in environmental toxins and health policy, and also saw Harvard students, faculty in primary care for 6 years. And I love seeing people from diverse backgrounds, but my real dream was to reenact and recreate my community practice like I had on the island of Maine. And so here I am in Back Bay, Boston, bringing out the family doctor into the community, where I'm also linked to some of the nation's best specialists at MGH, the Brigham, Beth Israel Hospital, bringing people the specialty care when they need it, but importantly, bringing them a whole systems look from a biological perspective, the social, emotional aspects of health, doing executive physicals, caring for elderly at home, seeing children. And what I love to do is combine what I'll call conventional medicine, MD trained medicine, what I've done for years, taking care of people, diagnosing diseases, using drugs or medicines to treat that, but I love combining that with more of a holistic approach. So I'll give you an example. So I take care of people with asthma. Patient comes in, they're wheezing. They say, "Doctor, what do I have?" I say, "Well, you have asthma because I can hear wheezing with my stethoscope. I'm trained to do that." So I prescribe inhalers. That's conventional medicine. I know how to do that. It's important to do to keep somebody safe sometimes from staying out of the emergency room from asthma. However, what I like to do is add to that a whole health look at, I'll call it upstream medicine, looking at why do they have wheezing in the first place. We know that wheezing is a combination of inflammation and spasm of the airways, okay? So we know that inflammation can come from environmental allergies. We know we're getting more evidence that it can also come from food sensitivities. Food sensitivities are an emerging field in medicine where it can cause systemic inflammation, inflammation that goes to other organs in the body. So some eczema, psoriasis, asthma, for example, migraine headaches, irritable bowel syndrome. Some of these are related to food sensitivities. I like to work with my patients to look for nutritional aspects to healing, in addition to doing the full conventional medicine.